Hello and welcome to the 79th Bi-Monthly Breastfeeding Coalition's webinar. I'm Camille Abbey, the Events and PR Manager at USBC, and I'm so glad to welcome you to today's session. Later on, Nikia Sankofa, our Executive Director of the USBC, will be joining us to facilitate the Q&A portion. This series is jointly hosted by CDC's Division of Nutrition, Physical Activity, and Obesity, and by the USBC. These webinars, referred to informally as the 222, are held on the second Tuesdays of even-numbered months from 2 to 3 p.m. Eastern. The purpose of this series is to bring together practitioners and advocates from the field of maternal and child health to share best practices, resources, and to network and collaborate on issues of national significance. We alternate the sessions, highlighting the work of breastfeeding coalitions one month and a national or international organization the next. Coalition members and breastfeeding advocates from around the country are invited to join us for these free webinars. To receive all of our announcements, please join the Coalition's Learning Connection. It's at usbreastfeeding.org/coalitions-connect. A free user account is required and it takes only a few seconds to set it up. The topic and speaker details are posted on the Coalition's Learning Connection as well as on the USBC public website, and that's at usbreastfeeding.org/coalitions-webinars. To streamline access, the webinars have been set up as a series. Once you register for a session, you're set. You'll receive reminders before each webinar with the topic and speaker details. We understand it's not possible to attend every session live in the midst of your busy day, so there is easy access to all archived recordings. The webinar presentation, handouts, and video recordings of this and past sessions can be found on the Coalition's webinar page. You can find the link on the chat box. The link to the webinar page is also in your webinar confirmation email. So how you get there from the homepage of the US Breastfeeding website is you navigate over to the Learning Collaborative right from the homepage and drop down into the CDC-USBC bi-monthly webinar series. For today's session, all participants are in listen-only mode. We will have about 15 minutes for questions and answers at the end of the presentation. We hope this presentation will be as interactive as possible, however, despite the virtual format. So please share your insights and questions throughout the presentation. You can type your questions as they come up for you during this session. Here's how you do it. Go to the control panel on the right side of your screen. If you don't see it, it may be minimized. Click on the orange tab and it will pop back out. If you scroll down below the audio section, you'll see a tab for questions. When you click on it, it will open a box for you to type in. If you have any webinar-related tech problems, please send an email to coalitions@usbreastfeeding.org and someone from our staff team will do their best to help you. And that brings us to today's session, the Physician Engagement and Training Focused on Breastfeeding Project. The USBC is honored to spotlight USBC member organization, the American Academy of Pediatrics. The American Academy of Pediatrics, AAP, was founded in 1930 by 35 pediatricians to serve as an independent forum to address children's health needs. At that time, the idea that children had unique developmental and health needs was new. The mission of the American Academy of Pediatrics is to attain optimal physical, mental, and social health and well-being for all infants, children, adolescents, and young adults. During this session, we will learn more about the AAP section on breastfeeding, and the CDC cooperative agreement focused on engaging and training physicians on the topic of breastfeeding. I'm delighted to introduce our presenters for today's session. Ngozi Onyema-Melton is the Manager of Maternal and Child Health Initiatives at the AAP. She staffs the AAP section on breastfeeding, the section on oral health, and oversees the Physician Engagement and Training Focused on Breastfeeding Project, a cooperative agreement between the AAP and CDC. Ms. Onyema-Melton completed her undergraduate studies at the University of Illinois in Urbana-Champaign and obtained her MPH degree from Benedictine University. She works with physician members and key stakeholders to develop educational resources and AAP policy related to breastfeeding and nutrition, oral health, and pediatric office practices. I'd also like to introduce Kira Beskin. Ms. Beskin currently works as Program Manager at the American Academy of Pediatrics, supporting projects focused on HPV vaccination and breastfeeding. She holds master's degrees in both public health and business administration. During her master's program, Ms. Beskin conducted qualitative research around HPV vaccination and bladder health. Prior to matriculation into graduate school, she worked for the U.S. Peace Corps for 5 years, both internationally and domestically. Thrilled to welcome both of you, and I will turn it over to you, Ngozi. Thank you so much both for joining us today.
Wonderful. Thank you, Camille, for that introduction. I'm just testing to make sure that you can at least hear me.
I can hear you great. Thank you.
Perfect. Okay, so we are just kind of transitioning over the controls. So good afternoon, everyone. My name is Ngozi Onima Melton, and I'm here with my colleague, Kira Beskin. We're with the American Academy of Pediatrics, and we're happy to be presenting our project with you on today's webinar. I'd like to thank USBC and the CDC for granting us this opportunity to present this afternoon. Okay, I'm still unable to drive the presentations. I don't know if, Kara, if you can.
Ngozi, if you mouse over there, yeah, did the little circles pop up? There you go.
Yeah, they popped up now.
Perfect.
Okay, so today we will provide a brief organizational overview of the AAP. We'll discuss the various AAP entities. We'll talk about the Academy's breastfeeding initiatives, and we will provide an overview of the physician engagement and training focused on breastfeeding project and our activities to date. So as Camille mentioned, the Academy's origins trace back to about 1929 during the AMA Section on Diseases of Children meeting. At a dinner of the section attendees, the subject of forming a new national pediatric society was raised and almost unanimously agreed upon. The society was officially incorporated in July of 1930 and named the American Academy of Pediatrics rather than the American Academy of Pediatricians to reflect the group's commitment to the interests of children and the pediatric specialty. The AAP is a professional membership organization of pediatricians and pediatric subspecialists. Our mission is to attain optimal physical, mental, and social health and well-being of all infants, children, adolescents, and young adults. To accomplish this mission, the AAP shall support the professional needs of its members. Today, the AAP is an organization of 67,000 members with 66 state and local chapters and over 80 groups where members can get involved and work on issues and populations they care most about. This next slide displays the Academy's chapters and districts. AAP chapters are independently incorporated organized groups of pediatricians and other healthcare professionals working to achieve AAP's goals in their communities. There are 59 United States chapters and 7 in Canada. The AAP's priority competencies include research, education for professionals and families, practice, which are resources that are designed to help pediatricians stay current on healthcare trends, effectively manage their careers, practices, and patients, and succeed in a competitive environment. There's also advocacy, where we deal with federal, state, and local level advocacy efforts, and policy, where we work on reports and statements and guidelines which set the standard. Today, I will highlight the AAP's breastfeeding initiative, which touches components of each priority listed here. The AAP Breastfeeding Initiative is designed to help the parent, advocate, and health professional promote, protect, and support breastfeeding. Through the AAP Breastfeeding Initiative, the Academy is helping to ensure that every baby is born into an environment that is supportive of breastfeeding. Leading this charge is the section on breastfeeding. Established in 2002, the section on breastfeeding is comprised of 500 members, which consist of pediatricians, pediatric nurse practitioners, and pediatric physician assistants. There are also 78 chapter breastfeeding coordinators who provide advocacy and breastfeeding expertise at the local and state level. The section is also governed by a 6-member executive committee that is elected by their peers. The mission of the section on breastfeeding is to equip pediatricians with education, policy, and advocacy resources to support optimal breastfeeding practices and environments. To obtain their mission, the section will promote breastfeeding by developing and delivering consistent messaging on the importance of breastfeeding. They will enhance pediatricians' role in breastfeeding support through the development and dissemination of evidence-based clinical information, as well as educational programs and resources for pediatricians and trainees. And lastly, the section will employ efforts to grow and sustain section membership and member engagement. Some of the activities of the section are included on this slide. The section has developed the most searched upon AAP policy, which is the breastfeeding and the use of human milk statement, which was written in 2012 and currently under revision. The section has also assisted in the development of the AAP clinical report on safe sleep and skin-to-skin care in the neonatal period. This report is intended to improve safety concerns around maternity care practices. This report also integrates some of the principal recommendations within the AAP Safe Sleep policy. This is a great resource for hospitals and academic medical centers working towards obtaining their baby-friendly designation. The section has also led the works around some of our more popular AAP publications. We have publications, books that are for families and consumers, such as The New Mother's Guide to Breastfeeding, the Breastfeeding Handbook for Physicians, which is currently in revision, but that publication is available to healthcare providers. And then the Breastfeeding Telephone Triage and Advice book is also one of our more popular publications. The section is also involved in a lot of breastfeeding legislative efforts at the federal and local levels. And we also offer educational opportunities through our national AAP conference and our PediaLink online platform. And then we've created the AAP Breastfeeding Residency Curriculum, which you'll hear a little bit about later from Kara. So now I'll speak a little bit about the AAP and the CDC collaboratives. The AAP and the CDC have held a solid organizational partnership for over 20 years. One of the earlier collaboratives included a meeting between the AAP, the American Academy of Family Physicians, AAFP, and the AMA and other groups, providing advice on childhood immunization. As a result of this meeting, the AAP and the CDC partnered to develop one simple schedule and format for routine childhood immunization. Other CDC-funded collaboratives have also included the following topics you see on this slide. Our latest endeavor with the CDC focuses on capacity building, which is improving knowledge and education for a particular topic area. But before I dive into the details of the project, I'd like to take this opportunity to share some background and describe some of the concerns raised regarding physician education and training around breastfeeding. There are a number of studies that look at the trends in breastfeeding attitudes and counseling practices. There is research that indicates a significant deficit related to breastfeeding knowledge and clinical management. And also that 43% of pediatric residency program directors felt breastfeeding-related training in residency was inadequate. And according to the most recent AAP periodic survey on breastfeeding, younger pediatricians were less confident than older pediatricians in managing breastfeeding problems. In an effort to improve attitudes and practices to enhance physicians' training and attitudes about breastfeeding, the CDC generated a funding opportunity to promote progress in breastfeeding education and improve clinical skills in providing evidence-based practices supportive of breastfeeding. This ultimately leading to a strengthening of the public health systems and services. The Physician Engagement and Training Focused on Breastfeeding Project is a cooperative agreement administered by the CDC and funded by the Prevention and Public Health Fund. The goal of the project is to engage physicians and stakeholders to develop recommendations and strategies for addressing gaps in breastfeeding training and educational needs. The project also aims to provide recommendations on training and educational needs to build capacity of medical practitioners to optimize breastfeeding practices. And the project also aims to support the safe implementation of evidence-based breastfeeding practices in maternity care facilities. So the primary deliverable of the project was to develop a comprehensive action plan that includes strategies and recommendations for addressing gaps in breastfeeding-related education and training for providers at different career points, in different settings, and in different specialties. And it was also to address the educational and training needs necessary to support breastfeeding and reduce disparities in breastfeeding rates. So when the funding opportunity was disseminated, the AAP was serving as steward of the USBC Physician Education and Training Constellation. So as many of you all are familiar, Constellation is an action-focused work team populated by interested members and partner organizations. This particular constellation had been in the incubation stage for some time, but because of this funding, the AAP was able to align efforts to implement and support activities related to physician education and training. So given the existing relationship with USBC, the AAP sought to partner with them by utilizing their existing infrastructure to engage and collaborate with other medical professional organizations and stakeholders that play a role in breastfeeding education and training of medical practitioners. A few years ago, USBC launched a new strategic framework designed to facilitate deeper, more effective, more inclusive collaboration across the breastfeeding field. Their new strategic framework puts into practice the principles of collaboration using the collective impact approach. As a backbone organization for breastfeeding, the USBC also provides infrastructure support to convene virtually and coordinate collaboration opportunities. Their unique platform and strategy and meeting design support adds such tremendous value to our projects. So during the first year of the project, we, the AAP, established a project advisory committee, better known as a PAC, which functions in a dual role as the Physician Education and Training Constellation and the Project Advisory Committee, which provides expertise and oversight for this project. We also organize key learning sessions and a webinar on the AAP clinical report on safe sleep and skin to skin. The learning session topics are listed on this slide. Some of the stakeholders involved in the learning sessions included CGBI, Empower and NCATS, Baby Friendly USA, MCHB's NAPS program on infant sleep practices. We've also heard from stakeholders like ROSE, the National Medical Association, and the National Hispanic Medical Association on equity sharing. We've also heard from representatives from the Association of Pediatric Program Directors and the Council on Resident Education, Obstetrics, and Gynecology around accreditation and training. During year one, we also completed a landscape analysis to assess the current scope of physician training on breastfeeding care and safe implementation of evidence-based breastfeeding practices in maternity care facilities. The following tasks were accomplished to complete this landscape analysis. We conducted an environmental scan to map existing breastfeeding-related education and training materials targeting healthcare professionals. We conducted key informant interviews with breastfeeding and healthcare provider stakeholders to identify concerns regarding education and training needs and perceived gaps in existing resources for physicians. And lastly, we administered and conducted a physician survey to assess the educational needs and concerns and identify perceived gaps in available resources. After evaluating the findings from the landscape analysis and pulling together the key recommendations noted from the learning sessions, the AAP developed a comprehensive action plan with strategies to fill breastfeeding-related education and training gaps. The Physician Education and Training Action Plan is available on the AAP website and many of our other stakeholder and partner websites as well. Strategies include integration of breastfeeding training in the various stages of formal medical education, encouraging culture change to support breastfeeding within the medical education and training process, and encouragement of continuity of care with community breastfeeding resources. This is a great resource for medical professional organizations, residency program directors, medical schools, hospitals, and other breastfeeding education training groups. So following the development of the action plan, the next phase of the project was focused on implementing strategies identified in the plan. In year two, activities included the review and prioritization of components of the action plan, supporting identified processes to implement action plan with our partner organizations, and developing resources tailored to the needs identified in the action plan. I highlighted the last bullet to share some of the relevant resources we developed during this period. This should be I just want to make sure I get through this last slide so I can hand it off. I'm just going to load it. So we developed the following resources tailored to the needs of the action plan. We partnered with the Academy of Breastfeeding Medicine to develop a statement for implementation of physician education throughout education curriculum. We also developed a model policy for support of breastfeeding medical trainees, where we collaborated with the American Academy of Family Physicians. We also worked with ACOG and USBC to develop a statement that delineates the medical practitioner's roles with regard to breastfeeding. And we worked with the USBC to work on a breastfeeding resource repository. And then we are lastly trying to get our findings from our landscape analysis published. And we are we've also worked on doing a market analysis of our breastfeeding residency curriculum. So this is where I will pause to hand over back to my colleague, Kara.
Thanks, Ngozi. You think you did a fantastic job describing what this grant is, really focused on training and educational needs for clinicians and providers. And so my name is Kara. I run the day-to-day logistics of this grant. And so I'll be talking about what we're doing currently and into the future. And so as Ngozi mentioned, this group is really fantastic and has been really prolific in making this action plan and working towards these. So this first deliverable is the AAFP model policy that Ngozi mentioned. It's focused on breastfeeding and lactation support for medical trainees. This year, we're excited to develop a pilot project. So actually, this number has increased. We're going to select nine organizations that host medical trainees or residents to try out implementing the AAFP policy within their organization. For 6 months, we're going to be doing a learning collaborative to see how it works to implement this policy. There's been research that shows lots of resident programs, over 85% of them have lactation rooms, but less than 10% of them have a policy on the books that support medical residents that are breastfeeding. The second project deliverable that we're working on this year is a culture plan to create a culture of support within the medical community. This one is less focused on policy, but more focused on the hearts and minds of people working within the medical community. There's research that shows that oftentimes a breastfeeding physician will feel very, very guilty that they might be putting additional work on their colleagues. Even when that same research shows that 80% of their colleagues don't feel like they're getting additional work. But we want to have a plan that organizations can put into their settings to support and make it clear that they support breastfeeding within their organization. Third, we're working to organize point of care resources that are evidence-based, that clinicians that are easy to access within the clinical setting. They can quickly look up some information or get some training about breastfeeding that they may need. Fourth, currently we have an online curriculum that focuses on breastfeeding. It was developed with faculty in mind, so faculty of med students and residents, particularly residents. And we want to update it. It's several years old. We want to update it to be not only for faculty, a great faculty resource, but also have self-learners in mind. We know that tons of people come to our website interested in learning more about breastfeeding and are often self-learners, whether that's someone that's been practicing for a while in medicine or is a med student or a resident. So we want to make that easily accessible to whoever comes to our curriculum. Lastly, we'd like to explore undergraduate medical education. And so that doesn't mean the typical undergraduate four-year degree that people typically get in biology before med school. We mean med students, so before they pick a specialty. This is a group that is learning tons of information, but we would like to target them to learn something about breastfeeding. So they know the basics of breastfeeding. Every specialty touches moms and babies in some way. We want them to know the basics so they don't get in the way of people's breastfeeding goals, but that they can help people get there. So we're exploring processes and diverse approaches to enhance undergraduate medical education for infant feeding. So as Ngozi mentioned, we have a project advisory committee for this project for the USB Physician Constellation participants. And so everyone listed here are great partners we work with on this project. So please follow this grant's work. You can visit the USBC Physician Education Training Constellation page, which is listed here. Talks about our 2019-2020 Constellation objectives that I went over, and those will be updated the next few months as we think about future years. You can also follow us here at the AAP about our breastfeeding work, Ngozi's section on breastfeeding, what they're up to, and our educational resources. So you can go to the AAP Breastfeeding Initiatives here at aap.org/breastfeeding. You can also check out healthychildren.org, which is our website that's focused on parent education, which is great consumer articles and resources on breastfeeding. So thank you all so much for your time today. Ngozi and I are really excited to answer any questions that you might have.
Thank you so much to both of you. Let me go ahead and see the questions that we have here in the chat box. So we do have a couple. One here is, what about AAP partners with artificial feeding industry? Can you talk more about that?
AAP partnership with artificial feeding industry, is that, if I'm understanding the question?
Yes, so this is from Betsy Ayers. Would you like to expand a little bit on that, Betsy? You could type in the question box so we can read that out for you.
Okay, so I guess I'll just start off by saying that the AAP definitely, the section on breastfeeding, in terms of our partnerships, we do not have partnerships with formula industry. If that's I think that's the question that she might be trying to ask. But this project is for the purposes of this webinar, this project is funded through the CDC funding mechanism, and then the section on breastfeeding is supported by Academy funds to do their work, which includes membership dues and so forth. So I guess I need a little bit more details about the question.
Yeah, so it kind of says formula company partners that would be in conflict. Can you talk more about that?
So the Academy, we do have a statement or a document where we talk about partnerships or relationships with industry that aligns with the work of the Academy. So I do want to put that out there, that there's a document that exists on that. I'll see if I can provide the link for those on the line that shares the Academy's kind of position as it relates to working with different partners. So once I get the link, I'll provide that with you. But we also the Academy is very supportive of breastfeeding. I do want to mention that with our policy statement, the 2012 policy statement definitely highlights the Academy's efforts around breastfeeding. But we are not anti-formula. We understand that there are medical needs for formula. So I also want to make sure I express that.
I also like to add to Ngozi's comments that this wonderful group of Project Advisory Council members, everyone that's part of this group, and I think it's a group of 30, it's quite a lot, needs to fill out a conflict of interest form with us to basically find out that fact. We don't want people that are, part of this group, this grant that's working towards breastfeeding goals, to also be, working for a formula company, for example. But yeah, that's a great question. It's important.
Thank you. So next question here we have is, let me see here. So we have somebody who would like to share their information, lots of positive feedback, and let me see. Okay, so here we go. Is the recommendation to require medical students and training pediatricians to have experience in hospitals that are baby-friendly being considered?
It's the recommendation from the AAP that residents be trained in hospitals that are baby-friendly. Am I understanding that correctly?
I believe so.
Okay, so we do not have strict guidelines or recommendations around the training and where that training comes from, if it's a baby-friendly designated hospital or not. I think for the purposes for this project, we are hoping to improve access and availability of training at various institutions and levels. So no, that is not the AAP's position in terms of trainees only receiving education and training from hospitals that are baby-friendly designated. I think we just want to make sure enough evidence-based content is made available to faculty members who are instructing and teaching breastfeeding to undergraduate medical education professionals, to even residents, to even the faculty who are hoping to incorporate this somehow into their curriculum. So we just want to increase the access of evidence-based information around breastfeeding. And the action plan, I'm just going to plug the action plan. It's a great resource for even if your hospital or institution is looking on strategies and ways to kind of include breastfeeding training. The action plan is a great resource to share with those individuals.
Okay, great. Thank you so much. So Amelia, if you can, is your line muted maybe? Just give me 1 second.
While Miriam's figuring that out, I'd also like to plug there's interesting research that's been published that's comparing different residency programs, whether they're baby friendly or not, and then their outcomes, whether that's like patient level data or if their residents have or physicians have a better time breastfeeding. So I'd encourage you to find that research. I don't remember who wrote it, I'm sorry.
Thank you. So next question is, in this project, sorry about that, do you have recommendations about lactation consultants or other providers in pediatric settings?
That is a great question. We do have something, I mentioned it about the statement that delineates the medical practitioner's roles with regard to breastfeeding, and hopefully outlining opportunities for collaboration between medical practitioners and other personnel, other breastfeeding support personnel. So that document, which was created in partnership with ACOG and the USBC's Constellation on Lactation Support Providers, that is in the very final stages, and we hope to publish and disseminate that soon. But that may be something that could help, that kind of outlines the various roles and how physicians should be collaborating and working with the other breastfeeding personnel staff. So once that's available, we definitely will be circulating it broadly, widely to our various partners and other membership organizations. I will say that the section on breastfeeding, I mentioned that we are currently revising our 2012 recommendations. And so when that document is published, I think many of our lactation support provider community colleagues will be interested in taking a look at that statement as well.
Great, thank you so much. The next question here is, are there breastfeeding questions on the medical exams that physicians take?
That's a question I think we might have to ask to our members of the PAC, those who are more involved in the design of the exams. It's possible, I do not know the answer to that. It's possible that a breastfeeding question might be included. Oftentimes, breastfeeding is kind of integrated deeply within nutrition-related topic, but I am not certain, and I will need to take that back to confirm.
Okay, thank you. That would be great.
It looks like Jennifer Nelson with CDC, who is involved in this project, is on and would be able to answer that question. So I don't know if we're able to unmute her, Miriam.
Yeah.
Oh, great.
Oh, perfect. So hi, this is Jennifer Nelson, and I am a pediatrician by training, so I can answer that question. Occasionally, there will be a lactation question on the medical exams, especially those for maternal child health specialties. But you can pass those exams with not knowing anything about lactation. And so that's, I think, one of the barrier or one of the struggles and challenges that we've dealt with this project is how, the medical school curriculum is so packed and there's so much to cover, both in medical school as well as residency and fellowship. And how do you integrate lactation and lactation management in an already packed curriculum, especially one that is geared towards, ensuring that you can pass your step exams and your board exams. And so, yes, there are occasionally questions, but you can definitely pass those tests without knowing anything about lactation or breastfeeding. I think the other thing too is that oftentimes, a question asks a very specific piece of information and not, even if you have the answer to that question and get that correct, I think, understanding how really to manage a breastfeeding dyad, takes a lot more than knowing just the answer to one question.
Thank you, Jennifer.
Yep.
Yeah, thank you. So moving on with something similar, will dental schools or other allied professionals also receive educational recommendations to include education on breastfeeding?
That is a really great question. Yes, they could. We certainly do have, another AAP group, the Section on Oral Health, which collaborates quite frequently with the American Dental Association, the American Academy of Pediatric Dentistry, and other dental colleagues. So we could share a lot of our resources with them. Ultimately, with this project, Karen and I had a call with our project advisory committee the other day. We want everyone who's entering into the medical field, ultimately will at some point touch upon either a family, a mother, child, father who may have a breastfeeding related issue, question, or situation. So we want to make sure that we are sharing our resources with both the medical and even the dental community. So I think that's a really great question and a really great point that they bring forward.
Great. So attached to that, there's a message here that says, I am a family physician teaching residents. Can non-members of AAP access the curriculum as well?
Yes.
Yep.
Free.
Sure.
It's open. There's a bunch of different resources on there that are free and open to access, including cultural case studies that are designed to just be printed off and talked about in your classroom. There's video links, there's different resources. Yes, it's free and open to anyone.
Great, thank you. So another question on here is, will the physician education plan be implemented at the AAP local chapter level? What is the time frame for this project?
So it's currently not, it's not a document that we have requested that the chapters implement, although I think that it brings up a great point that maybe we should create a resource and somehow reach out to our AAP chapters to see if this is something at the state and local levels that they could help facilitate. But it's a resource that's publicly available on our website for any persons or institutions that are interested in implementing.
Okay, great.
And but maybe that's something we will certainly consider. I think we should think about how our AAP chapters should get involved.
Great, thank you. So switching over to the constellation, is the physician education training constellation an option constellation, or is the membership restricted to organizations involved in the grant project?
So I think I'm going to ask also for Amelia's help on this response. That's a great question. I think it's open, but it's because it's housed within USBC's kind of, within their platform. I think that's a better question for them to address.
Yeah, Amelia or Alyssa, are you able to?
Yeah, this is Alyssa with USBC. Many of our constellations are open to our members in the field who are interested in, working on the specific topic. We have a couple that are have a very defined membership, and the Physicians Education and Training constellation is one of those as well. And I think Jennifer Nelson or Amelia could speak more to that. At the beginning of the project, it had the defined organizations, so all the medical professional organizations, the physician professional organizations, as well as kind of aligned public health partners. And so this is one that is not kind of open to the entire membership, but many of our topics are.
Thanks, Alyssa. So I think, let me just triple check on the questions. And I think if anybody has any more questions on membership for USBC AAP, we can try to share those links with you all. Okay. And I think with that, we can switch over. Thank you so much, Karen and Ghazi, for answering those. We are going to do a couple of USBC updates. Camille, if you're ready.
I'm happy to. Thanks so much, Kara and Ghazi. And thank you, Miriam, for taking us through all of that, various questions, various platforms. It's a lot to juggle. I think you did a great job. So I just wanted to offer a couple of USBC updates. Some things I know you've all heard us mention, but it's coming up soon. I can't believe it's not quite the end of this year, and we are already eyes on the horizon into next year. We are having our National Breastfeeding Conference and convening in Scottsdale, Arizona. That's our first conference west of the Mississippi. It's going to be June 12th and 13th. We'd love to have you all please save the date. If this group of more than 190 people all came to the conference, first of all, I'm sure it would be a lively and robust gathering, but we'd love to have you plus about 100 more. So please consider coming out to Arizona and joining us. And a couple of important updates pertaining to the conference that I need to mention. So pretty much by the middle of this month, so we're looking at like next week, we're going to be opening the call for presentation proposals and the award application. So both of those are going to be open. They'll be open until February 2nd, so pretty much through the holidays and through all of January. So we know the holidays are busy for many people. It also could be a quiet time if you happen to be someone who's working and it's a little quieter. It might be a great time to consider submitting for an award or for submitting a presentation. We will be announcing our theme as well at that time. So I don't want to let the cat out of the bag right now, but it's going to be out in any minute when we make those announcements. So those are the updates about the NBCC 2020. And I'd also need to just remind everyone that it is the end of the year. It is the giving season. We just passed Giving Tuesday, and thank you to all of you who contributed to the USBC. We are desperately and always in need of unrestricted funds, and that's the reason. The only way we get them is through donations from folks and organizations. So we are doing a really fun and cute sticker campaign for monthly donors. So anybody who signs up as a monthly donor, $5 a month or over, that's pretty low. Welcome, please. Invite you to consider more if that's within reach for you. We'll send you a fun sticker so you can show the world that you are supporting families, babies, and breastfeeding. And thank you for your support. So we really appreciate you considering both of those, the conference and and joining us as a monthly donor. And just wanted to mention also that there's various ways to connect with us. Obviously, Facebook, Twitter. You can subscribe to our Weekly Wire e-newsletter and receive our action alerts. It's a really great way to know all the things going on with policy and in the landscape of breastfeeding support. Of course, find your coalition, connect with the Coalition's Learning Connection. That's where you'll find this webinar recording, as I mentioned earlier. And want to make sure to thank everybody for all that you do. This is really one of our venues for the capacity building of the field, and we appreciate having all of the participation upon it of our presenters as well as of our attendees. So thank you once again, Ngozi and Kara, and thanks to all of you for the vital roles that you're playing for improving maternal, infant, and child health throughout the country. We hope that this session will spur ideas for collaborative action. Please complete the webinar evaluation. It happens right at the end of this. When you sign off, you'll get the link. It takes just a couple seconds. Let us know how we're doing. We value your suggestions. It helps us design future sessions that are relevant and of interest to you. And that's also how you'll get your certificate of attendance. So please complete the evaluation and handle it that way. I'd like to say goodbye for now. Happy holidays to you and yours. Happy New Year. We look forward to having you join us for our next webinar in the new year. Bye for now.